You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers! Today I'm chatting with Jennifer Brown. She is a veterinarian who is board certified in surgery as well as veterinary sports medicine and rehab. She's based in the United States and she has a practice called Florida Vet Rehab. We're going to chat about digital injuries today, and we're going to discuss which patients are likely to get injured, how we treat these conditions. We discuss things like taping, splinting, PRP injections, and as well as injecting with steroids, as well as all the therapeutic exercises we can do specifically for these cases with digital injuries. Before I hand over to Jennifer, a quick word from our sponsors. PulseVet are the global leaders in veterinary shockwave technology. They manufacture the ProPulse and Versatron family of products. Now, for those of you that don't know what shockwave therapy is, it's a non-invasive, high-energy sound wave therapy, and it can be used on both small and large animals. And we use it to treat multiple soft tissue injuries as well as musculoskeletal conditions. So with over 20 years of clinical research, PulseVet is used by top vets and vet rehab therapists to improve the quality and speed of healing, to relieve pain, stimulate bone and tissue growth, as well as improve the mobility of their patients. If you want more information, you can go to pulsevet.com. So without further ado, I'm going to hand over to Jennifer. Hey Jennifer, thank you so much for joining me.
Hey, thank you for having me.
Jennifer, I'd love for you to tell us how you got into the field of vet rehab. And I believe your story is quite interesting because you've gone from horses also into small animals. So share with us your journey into the profession.
Right. So I was actually later getting into veterinary medicine in my life too. I thought I was going to have a career in public relations, and then decided I had grown up, riding, showing, and even training horses, and decided partway through or almost graduating from my undergrad degree that I was going to switch up and do vet med, and then it was going to be equine all of the way. So throughout vet school was equine track, and then internship, surgical residency, and then faculty equine surgery. And while I was faculty at Virginia Tech, I became really interested in disaster medicine. Some of that stemming from, I grew, during my residency, 9/11 happened, and then watching all of the work of the veterinarians that responded to help support the search and rescue dogs intrigued me, of course, but, certainly in a residency is not the time to get involved in disaster response as far as that goes. Then the opportunity came up while I was faculty. Got deployed to Hurricane Katrina, works with some veterinarians that worked with the working dogs, the search and rescue dogs. And subsequent to that, wanted to learn more because I've been dedicated to equine my whole career from vet school on through, and thought, well, if I'm going to be effective at disaster response, I'm going to have to, brush up on some of my small animal, and started working with the working dogs, and found that was really interesting, where it's like, here high level athletes, like I work with every day with horses, but not a whole lot of understanding of athletic injuries in dogs, and just seeing the big differences between how horses and athletic dogs were being managed and treated, and how, little was known, as far as the sports medicine side of things. That subsequently got me hooked up working with an orthopedic practice in Maryland, and started doing a lot of their diagnostic ultrasounds for them and their stem cell injections and so on and so forth, as well. In concert with that, started training with an urban search and rescue team in my area, and I never was going to be a dog handler. I said, I'm happy to help support your dogs, deal with some of the sports medicine and other injuries. And now I have had 5 certified FEMA dogs later. One of them sitting on the couch behind me. It was my first FEMA certified live fine dog. Now, she's almost 13, so she's pretty much retired. And got really interested in that. That led to interest in rehabilitation. And when I made the move to Florida, I was doing half and half equine surgery and sports medicine, and then ultimately rehabilitation therapy. And now I'm full-time small animal rehabilitation therapy and in sports medicine, kind of a long and winding road as far as that goes. But I found that my equine background has really helped my canine work and helped my patients a lot as well.
Yeah, I mean, especially with doing musculoskeletal ultrasounds. I mean, equine vets are more used to doing that to normal GP vets. And so do you miss the equine practice?
Yes and no. I don't miss being up at 2 a.m. cutting colics anymore. So there's some things I miss: the orthopedics, the arthroscopy, the surgery. Of course, you dedicated, the first part of your career, doing that. So it's a little bittersweet, leaving that behind. I haven't left the education behind because it served me well. But I do miss the work. I do miss the horses, but I love my work now, working with in the mostly canine space, doing sports medicine and rehabilitation. So no regrets.
So you're here today to actually chat to us about digit injuries, and
Right.
you did a fabulous webinar for us. And you just made me remember one part of your webinar, which I absolutely loved, because I could see your equine side of you coming through. And you had a dog and you were doing flexion tests and then trotting the dog out. It's exactly like your horse work, right?
Right. Yeah. And sometimes I forget about my horse work. You kind of get, in how things are done on the canine side just through your training. You're like, why don't I do this like I used to do the horse work? Because it can be valuable in that regard. So yeah, I get a little giggle about doing that and teaching other people that, and other people that have crossed over from the horse horse industry and such too, or clients, because I have a lot of clients that they have competitive horses and competitive dogs, and they're like, hey, that's really familiar. It's like, they do that on my horse all the time. It's like, yep. And it works. It sometimes can really help refine your diagnosis, especially in digit injuries, but I use it in other things as well, especially if I'm having a hard time. I've got pain in multiple areas in a limb, on just standard physical exam, but it's like, well, which one is really troubling the dog to change their gait? Now, is that always the underlying thing? Not necessarily, but I think it does help do that. So I'll do the same thing with an iliopsoas stretch or knee flexion and that kind of thing, and see how much it alters their gait. But it can be very helpful, especially in digit injury, because you flex up all of the digits, and that you may get a pain response, and you may get pain response doing them individually. But I think in that video in particular, you could see how the different digits got much more dramatic response with one in particular or two in particular. So at least I could narrow it down, especially when things like x-rays are totally normal, right? So what digit should I focus on, when the x-ray findings are not, being particularly helpful in that regard. So.
No, I mean, it really got me thinking, and I thought to myself, I wonder why in veterinary, I never questioned why we didn't do that in small animals. It was just never a question. We just did it in horses, and we just never did it in small animals. And I sat there after when I watched that part of the webinar, and I thought to myself, yeah, I've never done this in any of my cases. But I'll remember that now. And I saw actually, like, as you said, you can actually really hone in diagnostically, like, where must I focus by doing it? So for those of you that can remember, if you're vets and you can remember all your flexion tests, consider maybe doing that if you're struggling to get a diagnosis in some of your cases.
Yeah, and I think that also goes, there's a lot we can take, from either species. And another one, kind of an emerging area that I've talked about for years, but just never have implemented, would be diagnostic joint blocks and such too. So, some really good work has been done out of Europe. Felix Doerr's new book has a whole chapter on it. ACVSMR just did a webinar on diagnostic joint anesthesia, just to see if that can help isolate some of these things as well. I don't know that we're far enough along in nerve blocks, just because of differences in anatomy and being able to isolate things, but some interesting things that I think we might be able to still bring over from the horse world into the canine world to help refine some things, at least for some pathologies and question marks in our physical exam. So
very interesting. So now we're going to be chatting about digit injuries. What is the most common ways that digits are injured?
Well, I think, it a little bit depends on, are we talking about the sporting dog or are we talking about the pet dog? I've had several pet dogs this year. Everything comes in threes. I had 3 in probably a month and a half period that came in from the yard, non-weight bearing lame, and all 3 of them had P2 fractures. It was like, and I dread splinting anything for various reasons, but of course all 3 ended up in splints and having to manage them. So the yard got them, unobserved trauma, in the yard. I think, in our sporting dogs, it's probably terrain related. I know a lot of work has, been done and being done looking at agility surfaces in particular. I don't know that I have a good feel on, what's better, dirt, grass, turf, indoors, outdoors, as far as related to digit injury. I don't think we know that yet. But there's probably something related to surfaces, particularly for agility dogs that, either they grab a toe, maybe related to, some of the obstacles like the tunnel or, something along those lines. But I think, whether we're talking about, see toe injuries in IPO or protection sport dogs and some field trial dogs and such too. So I don't know, that's not necessarily related to, the obstacles and agility in every case. People always like blaming the tunnel. I feel like it's probably going to be more terrain related or, surface related, but I don't have any evidence to back that up. More of an observation as far as that goes. So I think, obviously, in our sport dogs, we have to think about those things, but, are we, how we can prevent it? I don't think we have enough info yet.
And what degree of lameness can we expect with these cases?
I find that a majority of them are pretty dramatic, that they will be non-weight bearing. A majority, obviously for fractures, that's going to be the case, but even the sprain, strain injuries, and they may not always be every step non-weight bearing, but they will be like, a little bit lame, grade 2, grade 3, and then they just take a step and then they're hopping for 3 or 4, or they come out of their crate after rest and are, holding the leg up. And these dogs aren't just like toe touching. I mean, that leg is snapped up, especially in a hind limb. So, whether it be just even for a few steps, I find that they're more lame in general. I'm usually seeing them fairly acutely. The arthritic dogs, the arthritic digits and such are a little bit different. Those are, going to be kind of chronic low grade lameness, but the sprain strains, the acute ones, they're pretty either intermittently dramatically lame or pretty dramatically lame from the get-go.
And for those sports dogs, so for example, like the agility cases, if they have a sprain or strain, I mean, what is the prognosis for those dogs to compete again?
It depends a little bit on, I think, the instability of the joint. I see 2 different types of injuries. So I'll get sprain strains of the joint, probably, some medial collateral ligament involvement. And then I'll get the flexor tendinopathies, as well, and some of that depends on how much joint damage I think that they have. Those sometimes can take a bit more time, not that both of them can't be, take a lot of time to ultimately get them resolved. I've had all of them go back to sport. I've had some of them don't trouble the dog in the long term, so they get a really arthritic digit that seems to cause them problems intermittently, and you have to kind of decide, how are we going to manage that over time. And then I've had others that never look back. A lot of the hyperextension injuries that I see typically will go back. Their toes may always look funky, but they seem to be fairly resilient. I only have one dog, and granted, I don't have tons of these, and there's not a lot of them out there, but have have one that it troubles him every now and again. But the majority of them, their toe, sticks straight out, but they can run just as good as they did prior to. I've actually had a couple that another vet saw them, told them that they had to retire them because of this hyperextension injury, and they were non-painful, looked good. I mean, this was months down the road. I said, go back to work. And they went back and was on the podium at a national event. I didn't do anything, so I can't claim credit for that whatsoever. All I did was give you the blessing and go back to work, because I didn't think that would cause a problem for the dog, and it never did. She did great.
And is there not a worry that, especially if the toes are sticking out like that they can injure themselves again?
Yeah, I haven't had that. I think some of them will get, the ones I've had a little bit more problem with is if they're both the third and fourth digits are, because I think then the second and the fifth are taking up a little bit more slack, and I'll get some pain at the metacarpal or metatarsal phalangeal joint a little bit, just because they don't have that other toe to, I think, help support the additional stress on them, but not really. A lot of the ones that are just the single digit, I haven't had any problems. Once we've gotten over the ones that I've had where I've got them from the acute phase, so right after injury, or the ones that were the chronic ones, they never had any issues. Again, I basically just sent them back to work. I've had ones that have cropped up with another digit on another foot, and I don't know, that was a Doberman, and I just think they've got such long phalanges that I don't know that they're necessarily predisposed, because if you look at my cases in practice, they're all majority of them are agility border collies with hindfoot hyperextension injuries. So I think we need more data to know that, but this one dog in particular had did it twice, one on both front feet. So
and most of these cases, are they referred to you from other vets as sort of just, can you conservatively manage this or treat this? Is that how you see them?
Mostly it's for my sport dogs, it's mostly self-referral, as far as that goes. Some of them have been treated by other veterinarians, but most of the sport dogs are referred or word of mouth through other clients of mine that have sporting dogs. I do have a few that have come from a surgeon that the dog was managed, had a fracture, managed in a splint, and then is having some laxity issues. So I'll get some of those that are referred. But most of my sport dogs are self-referred or word of mouth.
And do a lot of them have surgery, or are you treating them mainly conservatively?
All conservative. I don't know that the only one digits I've ultimately sent for surgery would be amputation. When we just haven't been able to manage an arthritic digit or starting to get other compensatory problems, and really it's, all of my, all of the things that I would, typically treat with just are not being successful. And not very many cases, and been pretty fortunate to be able to, that most of mine have been able to been managed conservatively. Never have had a fracture I've had to send. Most of the surgeons I talk to say as long as the fracture ends are in the same zip code, they'll heal. That digit injuries heal very well non-surgically, and so I think if we figure out a good way to support that digit and keep them confined, then we can get them there eventually.
So what are the strategies that you're using to treat these digital injuries?
A little bit depends on the injury. So, I'll do anything, from taping, either extension block or buddy taping, to splinting, for arthritic and arthritic joints or bad sprain strains that have a lot of joint swelling, I'll inject the joints, PRP, steroids, et cetera. So a lot of that is going to be injury dependent and clinical sign dependent as well. And then of course, your standard modalities when you've got active inflammation and need to manage pain, good pain management. I also do, again, here's the equine person creeping out in me a lit. I'll use topical DMSO a fair bit on, swollen digits, and especially when I suspect tendinopathies and such to, help with some of the inflammation. So, and we'll use some like arnica gel and that kind of thing too. But, so certainly, the modalities to help with, with the inflammation as well. So.
In your webinar on the Small Animal on Untitled platform, so those of you that are on Untitled members, you can hop over and have a look on the platform and watch that webinar if you haven't already. But you went into some great detail about doing the buddy taping and how you tape it. So we don't have to go into that. But one of the things that you mentioned is when you're doing this taping, it can sometimes be a problem that the taping actually causes rubbing. How long are you generally taping these cases for, so in a number of weeks?
Yeah, typically 4 to 6 weeks of full-time taping. And again, this is going to be very injury dependent. So there's two types of taping. There's the buddy taping, which is where you're taping one digit to the other to support it. Then there's a modified extension block taping that I use for the hyperextension injuries. And that's just to help pull that toe into flexion and maintain it. Both are going to have the associated morbidity with taping. It's not benign. It was found in human research, same exact thing as that, not benign in people as well. So just because you have hair or no hair, you're still going to potentially have problems, with the taping. And that will vary, because if we do get a lot of morbidity associated, with the taping, we do have to sometimes modify how long we tape. But, if we're looking at a bad flexor tendon injury, I mean, those take months to heal. And so initially we just need to try and support that toe and that tendon, as well. I probably tend to tape those longer than I do my sprain strains, as far as that goes. So flexor tendon injury is a little bit easier to diagnose than some of the ones, the sprain strains. And so I don't always tape, those, unless there's some obvious medial collateral ligament issues. And usually I can pick that up either on x-ray or ultrasound. And those all be.
From your webinar, you use something which we call elastoplast.
Yeah, elasticon. Mm-hmm.
Yeah.
Yep.
Have you ever tried to tape using vet wrap? Do you know what vet wrap is?
Mm-hmm. Yep, we have the same. Yeah.
Yeah.
So the one thing with vet wrap is it doesn't stick to the dog, which is a good thing, right? Because you're not going to have the skin issues. So sometimes we'll use vet wrap if ultimately the taping is being problematic, to cover irritated areas, and then carry, if we can use that to secure some of the taping to it instead of the dog. As far as that goes, I've started using some more K-tape, rock tape as well, because it does allow, at least a little bit more flexibility, but I find in some dogs it's just not sticky enough. So that elastoplast or the elasticon, some of them will look a little wild because we'll use a combination of things, so it's however you can get the job done, as long as it's securing the digit in, how we're looking to have it stabilized. I think the sky's the limit. You're only limited by your creativity. But this stuff does have to stick, because I do think, and it can't be too stretchy is the other thing. And that's, I like the waterproof K-tape, rock tape better than the other, because I think I can, one, it seems to hold better on the dogs. The other, I feel like I can, and this is purely subjective, maybe a little bit stiffer as far as that goes. Because if it has too much stretch and you can't get the stretch out of it, all that toe is just going to move against, the tape. It's just not going to be restricted enough in some cases. So we want some movement, but on some of these, you want to really restrict down that movement so it's not problematic.
And are you changing that tape sort of every 3 to 4 days, or depending whenever needed?
As needed, because obviously, things get wet and, that I find that the owners, most of the ones that end up taping are some of my best clients too, that I know can handle it, because they're having to change it. They're not coming to me. I mean, some of them live, hour or two away, and they're just not going to be able to come back. So one of them lived 4.5 hours away. So her husband was a medic in the military, and so he was very handy at stuff. And he was taping this Dobe's toe and such. So they get very good. They get better at it than I do. So they come back in, and then they see me trying to retape it, and they're like, no, here, let me just do that for you. And I'm like, okay, that's good. They've got a system down, and they end up being much better at it. I need to hire them to come back and just tape toes if I had enough, as far as that goes. So they learn to do it. It's not terribly complicated, in that regard, if you really, show them how you want it done and such too. And very often I learn something from my clients, because they've like, this, what you did was fine, but this seems to work better on my dog if I just put this piece of tape here and that. And as long as it achieves the goal. And we've had to move taping around, like they start to get a bit of skin irritation, lose hair, redness, sores. They've moved tape up and down and changed sides of things. So I think that's.
So for the listeners, that webinar, there's some really great videos and really great pictures. And Jennifer explains exactly how she does all those taping techniques. So you guys can go and have a check out of that. Let's move on to therapeutic exercises for dogs with digit injuries.
Yeah. So, I mean, obviously, you got to get these guys rehab too, right? So, you're not going to rehab those tendons and ligaments themselves, right? So they're not what control, the position necessarily. It's coming from the muscle unit, above. And then, in addition, if you're dealing with a sprain strain injury, making sure that we don't lose too much range of motion in those digits. So, always the big question is, well, how do you rehab a toe? In people, digit rehab is a thing, and a pretty important part of, of dealing with sprain strain injuries and dislocations and so on and so forth, because obviously we need our hands and we need our fingers to function properly for just day-to-day tasks, such as writing and just, doing normal tasks, let alone if we're an athlete, right? And so certainly, both toe and finger injuries are, have some pretty extensive rehab associated with them on the human side. So they use a lot of gripping and certainly gripping type exercises, range of motion, squeezing the little balls and, and soft surfaces. They also will, one thing I wish we could do is with some of their flexor tendon injuries is that they have some really great splints that provide that they can gradually change how much that finger can flex and extend. So it's a very dynamic process through, that they'll allow more range of motion, or you can extend but not flex. So that's the extension block, taping and splinting that they do. So they have some really cool tools that I wish worked on dog feet, but don't, unfortunately. So, that's kind of the big question is, well, how do we get this dog to flex and extend its toes? So we're looking at, the flexor and extensor muscles of the forearm or the hind limb. So those are the ones that we're looking to work, and you'll find too that those can get sore when they have mostly talking about flexor tendon, and even maybe to some degree in more so in the forelimb extensor injuries. Obviously strain's a little bit different story. That's more of a pain, inflammation, joint issue. So that might be a little bit different category, but certainly for flexor tendon issues and that, we depend a lot on things that make them do that. So the unstable surface, digging, which, some people can train their dogs to dig. Some people don't want to train their dogs to dig, sometimes we don't want to encourage bad behavior, but I have had people train their dog to dig, like you can dig in this little tiny sandbox I've made you, and this is, how you can do it. And I've had a few clients that have done that, as far as that goes. So I use a lot of the unstable, surface to have them reach from side to side. And if I see through the course of us doing those exercises, or the client sees the dogs, going into flexion and extension, moving those digits, we know that's a good exercise. And every dog's a little bit different on that. So what one surface may work well on a dog, another. I had one dog that didn't have any really obvious gripping on fit disc, fit bone, any of the, the inflatables, kind of the standard rubber, tough rubber ones. But if I put him on an air mattress and brought him right to the edge of it, and he had him lean forward, almost like he was going to come off the air mattress, he'd grip the edge of the air mattress. So it took me some time to kind of work through where I would see that flexor activity to work the flexor muscles in that particular dog, which was my target. So, but in general, that kind of soft surface. Another one that I think works really well is crawling. Especially if they're kind of army crawling under a low object, you'll see them reach and grip to pull themselves across the floor. So some dogs know army crawling as a cue. Those pet dogs that I'm trying to work on that stuff with, go under a chair or a coffee table of the right height, some kind of object. For that, and you'll see that extension and them pulling themselves forward. They'll use their digits a lot for. So those are kind of some of my go-to exercises for working the flexors. Sprain strains can be helpful as well. Probably focus more on kind of pain management, decreasing inflammation and range of motion, as long as the dog tolerates it. And that's probably the biggest challenge. Is dogs hate having their feet touched anyway, in a majority of cases. When it hurts, they really don't like having their feet touched. And so I find that can sometimes be the more difficult thing to get cooperation on. If it hurts, they just are not going to allow it. And so just have to, good distractions, ice, heat, good pain management, after modalities, working on that range of motion and stretch and joint traction and joint mobs and all of that can be sometimes more challenging for the client depending on the pet's behavior. Because the hard thing is you just don't want to ruin the relationship between an owner and their dog, through the course of therapy either. And so sometimes overcoming that can be a little more challenging especially with toes, because they hate having their feet messed with on some cases.
Yeah, and it's also challenging for us sometimes just diagnostically because of the way that dogs are about their feet. And maybe it's because of nail clipping and vets, and how funny they are. They can be really funny. Like sometimes you can have nothing wrong with their feet, and they'll be pulling away as if there's something wrong.
Yeah, and that's if I suspect a toe, they've been a little. So usually when I'm doing my exam, I'll flex and extend all of them at once. So I'm not actually touching any individual toe. And if I get an adverse response to that seems more painful than just don't touch my feet response, I'll finish the rest of my exam in that limb, assure that there's nothing that I'm suspicious of there, and then go back to the feet and try and just desensitize them. Have my assistant distract that, and then kind of repeat it. I'll use a lot of flat hand flexion extension, so I'm not grabbing an individual toe, and then I'll try and stay away from the nail to do individual flexion. So try and ease them into it, as far as that goes. But it can be challenging, right? Because you go to do their toes and they're darting across the room and all of that, because they are adverse to having their nails trimmed. So yeah, that can be the challenge, that's for sure.
How do you feel about these patients when you're rehabbing them walking in soft sand?
Yeah, that's another. Terrain changes, I think, is one that's good. So I live in Florida, sand is something of abundance. Hill work is not, so we don't have hills, but we got sand. So so sand, and I always tell people it's like early in the injury, walk close to the water. Later in the injury, walk towards the dunes where the sand is soft and not wet. That can be, some dogs will grip more over grass, real big spongy grass, change in terrain, things that are, bumpy dirt and such. You got to be careful with some of that with some injuries because it can make them more sore. So you certainly want to stage that in and have the owner be really observant. Is this, well, if I walk over X surface, they tend to be a little bit more sore, but they might not be ready for that based on their injury.
How do you feel about using booties in these type of cases?
I don't use a lot of booties. If I have to, if I'm really having to, stabilize or immobilize, for something, they're usually in a splint. Booties mostly for, for foot protection. I'm not sure how much stabilization of a digit that they would ultimately do. So I haven't used it. Other people may have had some, more success with that. I've used, some booties, some of the custom, ones, mostly for old dogs that have that chronic, all, digits are hyperextended and they've got a lot of kind of generalized foot pain in an effort to try and stabilize those digits. Because I'm not going to tape, on a dog that has 4 hyperextended digits, I'm not going to tape all of those up into flexion. They've got other things going on that have led to that. And maybe they have, because they're older, have some, collagen related issues, or they've got an overload issue because they've got horrible spinal disease or hip arthritis, or et cetera. So I've tried some booties with various success. I'd say owners have struggled with getting them on, keeping them on, or have felt like that, especially because we're, again, dealing with some of these older geriatric dogs that struggle, I think, with anything you put on their legs anyway. Not because they're particularly heavy, but it was restricting other things, right? So their carpal movement and such. So I have not had much success. I'm sure there's cases out there that probably have been more successful, but I just haven't been with booties, either custom or non-custom. I use them for foot protection and protecting wounds and such, or to prevent them from chewing the taping off. Occasionally I'll have a client that has to do that because the dog will self-extricate from its taping. So we've used some booties to keep them off the tape.
Yeah, I think in those old cases, booties can sometimes just be cumbersome, right? So like it's when I see them walk, it looks like it interferes with their breakover. And then they sort of just feel like they look like they're all feet, they're not really sure where their feet are.
I mean, it's always fun to put your dog in booties and watch them walk around, right? So we try and, in the search and rescue side, this is something, especially after 9/11, after 9/11, all this, the system got donated thousands. We had these trifold containers that are probably about 4 feet high by 4 feet wide, full of booties in a warehouse. They got donated for our search and rescue dogs. Well, we don't use them in urban at all because dogs can't traverse rubble in booties. It'd be like rock climbing in mittens, right? So they use their digits a lot for dexterity, and this is not just specific to search and rescue dogs, but I've seen my dog save herself from a 20-foot fall off of a concrete slab by digging in and pulling herself up. So we would never use booties, but people, that's the common question. Well, do you use booties? Like, no, because they need their digits. It's like, well, what about all those foot injuries? Because foot injuries are the most common thing we get in our search and rescue dogs. It's like, well, they're going to get foot injuries, but that's better than a severe injury because they've missed a jump or, had a fall because they couldn't get the grip or the traction. So,
yeah, the foot injuries are a small thing compared to what could potentially happen if they fall.
Right. Exactly. And I've witnessed it on my own dog. So if it further solidified the terrain over flat surfaces and, where they're not having to negotiate something, I think they're good foot protection. You can get a dog adapted to them. I do think that I agree with you. Having had, many foot injuries, I've had some nail avulsions and such. I've had to, have my dogs in bandage, but still need to be able to work. And they don't move exactly the same, and it's going to restrict more than just their digit movement, right? Break over at the carpus, affecting other joints other than the ones you're trying to protect. And that can be true of any external coaptation, right? So that's the challenge when we have digit fractures, right? So they're, in external coaptation. And that's why for a lot of sprain strains, I don't put them in splints unless they force me to, just because of the consequences of splinting is, it's not inconsequential, as far as that goes too.
So we have a few Facebook groups. For those of you that don't know, we've got 4. We've got the Equine vet rehabbers, small animal vet rehabbers, hydro vet rehabbers, and our business vet rehabbers. And Jennifer, we had a question in our small animal vet rehabbers Facebook group, and it was just a really great conversation. And so I thought it's really applicable to the conversation that we're having. And so I thought I would just read you the question, and maybe if you could just give your opinion, I'd really appreciate it. So the vet rehabber had an 8-month-old puppy that had a flat foot secondary to a pinch injury and a broken P2 of digit 3. The fracture had healed, but now they were finding there was laxity of the superficial digital flexor of digits 3 and 4. And they were just looking for recommendations on how to treat it.
Right. Yeah, not an uncommon issue. And that would be, where I get a lot of my referrals, from surgeons and such that have had these P2 fractures, and then the dog was, ultimately needed, rigid, external coaptation to have them be, non-weight bearing to allow that fracture to heal. And so, the consequences of that, complete immobilization leads to a lot of issues, not just with laxity, but also the joint, all of the joints that are underneath that immobilization. We know it has effects on collagen, weakens muscle tendon units, and some of those interfaces of, the tendon to bone and ligament to bone as well. And so laxity is probably my most, other than the morbidity associated with the splint itself, because, sores and such are pretty common, right? So these dogs are pretty willing to walk around on the splints. And so, no matter how good of a splinter bandager you are, it's very uncommon to not get some kind of sore. And then the other one, that probably the second most common issue we deal with that external coaptation, is the laxity, right? So you're affecting all of that. So everything gets weak, right? So you're splinting one toe, but you end up with a, pretty flat foot. And so how I typically will manage those, a lot of rehab, a lot of range of motion. I use, hydro and water, both underwater treadmill and swimming a lot in those dogs too. I forgot to mention that when we talked about, rehab, a lot of the unstable surface, such. I haven't taped a lot of them unless they had one digit in particular. I had one that the affected digit, so I can't remember which one. It was a forelimb. I think it was the 4th digit that was fractured, and that one he had and it was meant to be a conformation dog. So of course they had to have, and it was a dobe, so we didn't have any hair to cover. If he had been a more hairy breeded foot, a little more hobbit footy, that would have helped us a little bit. But being a Doberman and having, no hair in his feet, it was very obvious, that he had a flat foot on one side. So the one toe we did tape after he was out of the splint and the fracture was healed, mostly to just help support it in flexion while we rehabbed the whole foot, and did a combination of, underwater treadmill, had the taping, in our modalities, as well as working on range of motion. But the big thing too is, and we measured the muscle mass of the forearm was hugely different than the opposite side, as far as that goes. So we really had to work those flexor muscles, as well. So, and that was the big part that I think he had gotten so much flexor muscle weakness from being in a splint, up to his elbow, that because of that complete immobilization, that he got lax. And so we corrected all of those things. That one toe still stuck out a little bit, but the the handler found that if she showed him on grass, it wasn't as obvious, and he ultimately went out and got his championship and such. So it didn't get quite perfect, but it got close enough for him to be able to do what he needed to do. So those were kind of the areas we focused on, especially when they were completely immobilized, working on those flexor muscles to see if we could get everything to just kind of tighten up. Get those stronger again, they're going to help pull those digits back into position.
Thank you for answering that. Jennifer, thank you so much for this wonderful chat. It's been really, really interesting. For those of you that want to know more about digit injuries, you can head over to the Online Pet Health Small Animal platform and go and check out that webinar that Jennifer did for us. It really was great. Thank you so much for your time, Jennifer.
All right. Thank you for having me. Really appreciate you letting me blather on about digit injuries.
It's awesome. Thank you.
Thank you.
Bye.
Bye-bye.
If you enjoyed listening to this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about veterinary rehabilitation. For more information about continuing education for vet rehab therapists that you can do online, you can go to onlinepethealth.com. I'd like to thank you for listening to this podcast and, of course, thank our sponsors, Pulse Vet. We thank them for their commitment to their mission to improve the quality of life of the animals that we all love by developing, validating, and providing advanced shockwave therapy at the highest level of support and service. Remember, you can reach them at pulsevet.com or info@pulsevet.com. See you all next week.